This 6-year-old male child is brought for evaluation of murmur, detected by routine school health checkup. Normal delivery, low birth weight. During newborn period and early infancy, a heart murmur was detected and some abnormalities in blood work, the details of which is not available with the patient now, and family did no further follow-up because the child was totally okay according to them. Child is a very happy and interacting, friendly with doctor. And on examination, weight and height are less than 3rd centile. Dysmorphic facies is there. And ejection systolic murmur in the aortic area. We will listen to the murmur. So since it is best heard in aortic area, possibly it is rising from aorta, and there is no obvious click. So it is possibly not a valvular aortic stenosis, but possibly an aortic stenosis. So OSCE questions are: what is the most probable diagnosis? We have to look at it like a dysmorphic child with aortic stenosis. The commonest syndrome that we know of having aortic stenosis as a component is Williams syndrome. So most probable diagnosis is Williams syndrome. And CVS diagnosis, aortic stenosis, you cannot say it is supravalvular from clinical examination, but we can, maximum what we can say is it is not valvular because there is no click. What additional clinical examination in CVS will you do? We will look for the apex, like heaving apex for concentric left ventricular hypertrophy, thrill, aortic areas, suprasternal notch, etc. Conduction of the murmur to the carotid. And since it is not a valvular thing but an arterial thing, the stenosis is arterial. So other arteries are also involved. A common thing is renal artery. So if renal artery stenosis is there, you can auscultate for renal bruit. And of course, you can look for the BP, which will be high. Although it is not asked in this question, another history that we ask is how is the child in school performing far below the average, because that is also expected in Williams. That you need not write in this because it is not asked. Now the blood work abnormality is hypercalcemia, and the diagnosis is by genetic testing, that is FISH, to look for the specific deletion of chromosome 7. The area of deletion you can just look up. I can't remember it offhand. Regarding the clinical features, it is best to have a look at the clinical photograph and read about the clinical features. I recommend that you read my clinical book. Thank you for watching.